Okay, this video is how to prevent breast cancer. And yes, if this looks familiar, that's because it is. I already gave most of this video already, but the reason I'm doing it over is because I've noticed with YouTube, if I do the video slightly different, it sometimes has a dramatic effect on how many people see it. So I'm just going to talk about risk factors for breast cancer. How do you prevent it? Basically, for any disease, you want to know what causes disease and avoid the things that cause the disease. And there's certain things I won't mention, like this one right here, number 2. I won't mention that, all right? Because I think certain things make it less likely the video is going to be seen. All right, early onset menarche. A lot of kids nowadays are exposed to things like dairy, which has a lot of estrogen in it and can cause early onset of puberty. Delayed onset of, having a kid can create increased amount of time with unopposed estrogen, increase the risk of breast cancer. Not having any increases the risk of breast cancer. Not breastfeeding increases the risk of breast cancer. So it's natural that the breast kind of goes through phases of, just regular estrogen versus everything to do with maternity and nursing. Long-term use of some of these, I won't even say it. Postmenopausal administration of this. These are things that can increase the risk of breast cancer. There's lots of estrogenic chemicals in personal care products. The worst is deodorant. You got shared lymphatics between the upper outer quadrant and the breast. Used to be in the 1920s about 25% of breast cancer is upper outer quadrant. Now it's about 60%. So people put this estrogenic deodorant. It's got aluminum and metalloestrogen. It's got parabenzoic acids in there, preservatives that are estrogenic through the shared lymphatic. A lot of women shave their armpit first and then they put that stuff on, increasing transdermal absorption. And biochemistry, like dissolves like. So you put a lipid on there, like the estrogenic chemicals, and they're going to be transdermally absorbed through your lipid skin. Your skin's lipid, all right? It makes sense because when you swim in the water, you don't become waterlogged instantly because your skin keeps water out, because lipid blocks water, but lipid does not block lipid. And so when you put estrogenic chemicals on your armpit, they get transdermally absorbed. Shared lymphatics, they mix with the upper outer quadrant of the breast, increasing your risk of breast cancer. Estrogenic chemicals in general cause proliferation of breast ductal cells. What's the most common type of breast cancer? Breast ductal carcinoma, okay? So you want to avoid all this stuff to the extent you can. You don't need deodorant. Deodorant's stupid. Somebody wearing deodorant, to me, it's an indicator of a low IQ. When you walk in a room, you say, hey, how you doing? You don't smell each other's armpits, okay? It's just conformist brainwashing to believe that. Somebody's sniffing your armpits, they like you, okay? So you don't have to convince them at that point. All of these common personal care products. The reason why estrogen's in everything is because it's a good preservative. Got a long shelf life because of the benzene ring, and then it's antimicrobial because of the phenol group sticking off of it. That's what interacts with the estrogen receptor, and it's ubiquitous in all these preservatives. So it's in your shampoos, it's in your conditioners. I don't even use shampoo. I don't have much hair, so I don't need it. But even if you got more hair, you don't need to use it every day. It's in perfumes, preservative, lotions, sunscreen. Sunscreens will often have multiple, and they can stay in the body. You can test them a week later; it'll still be in their blood. Estrogenics in dishwashing. If you're not cooking with oil, you don't need dishwashing detergent. I just rinse it in the sink. Laundry detergents. Unless you're working an oil rig or something like that, you can just rinse your clothes with hot water. You don't need detergents. Tap water has a lot of estrogenics in it, and also has aluminum and metalloestrogen. You can remove the regular estrogenics with a carbon filter. Aluminum, it helps have reverse osmosis. Certainly, at least in your kitchen sink, it would be good to have that. Dairy cow, like I said, they're engineered to be pregnant while they make their milk nowadays, so their estrogen levels are higher. Estrogen's a fat storage hormone, makes people gain weight, being obese. Also, you have increased enzyme aromatase to convert androgens into estrogens. Diabetes raises insulin-like growth factor, and insulin increases your risk of breast cancer. Hypertension is associated with atherosclerosis, tissue ischemia, and increased risk of breast cancer. Okay, so what I'm saying is, you eat a low-fat, low-sodium vegan diet, organic only, you prevent all this stuff, and you minimize your use of personal care products. You basically live like Adam and Eve, but keep your indoor heating and plumbing. Basically the good old-fashioned Christian way of life, like your grandmother could have told you, leads you to be healthy and happy. So you don't gain by breaking against it. You gain by figuring out how to make it work with your own life. Okay, don't drink alcohol, don't smoke tobacco. Exercise, because your lymphatics don't have a pump. They're not connected to the heart like the arteries and veins, so they're pumped by exercise, and which means your WBCs, white blood cells, move around your body. They circulate and they check all the cells. You know, your self, non-self. Cancer is non-self. It has abnormal cell surface antigens, and so the immune system recognizes it and removes it. So the more your WBCs travel around your body because you are exercising, like 10 to 30 fold increase in lymphatic flow, you'll have a better ability to remove cancer cells from your body. Let's see what else. Getting your sleep, adequate sleep, improves immune function. People who work the night shifts, they have like at least 50% increased incidence of breast cancer. Not good. You don't want to work night shift, especially after you're 30 years of age. You also want to have good circadian rhythms. Try to get some sunlight in the daytime, be around some bright lights. At night, you want to avoid blue lights because our perception of what is day or night is dependent on photoreceptors for blue light. So you want to really avoid blue light at night if you can. Some people wear blue light blocking glasses. There's newer things coming out, circadian rhythm lighting, whereby you will have zero blue light in your lights, you know, a little red light or something in the nighttime. That's preferable because, you know, your computer screens, your cell phones have a lot more blue light in them. You don't want that. Almost all lighting, it's more and more becoming these blue LED lights, which are not good because your photoreceptors perceive that as daytime and it messes up your circadian rhythms. And you want darkness at night, especially the last 3 hours before you go to bed, relatively dark, or certainly in absence of blue light. You'll produce more melatonin that way. Melatonin sends a signal to all the cells in your body that it's time to sleep. It's also antioxidant. It helps minimize the risk of cancer. It does a lot of good things. Other things. Avoid excessive psychological stress. Avoid caffeine because it mimics psychological stress. Elevated cortisol and catecholamines, which are immunosuppressants and decrease your ability to sleep, increase your blood lipids. Let's see what else. Don't put your cell phone in your front pocket. You do that for a couple of decades, you increase your risk of breast cancer. It's a low power microwave transmitter, not good. It can also change EKGs. It's not good for your heart either. Practice one of the major, religions. You know, those people who do that, they're healthier. Weaker associations are, you know, excessive exposure to volatile organic chemicals, things that smell bad, car exhaust, truck exhaust. I love the way diesels often park in front of hospitals and they leave their engine running. Okay, so everybody who has to walk past them has to smell their diesel smoke. You'd be surprised how many ambulances do that everywhere I've ever seen. Okay, nonstick cookware, perfluorinated, not good. Flame retardants. On furniture, those are estrogenic. Smoking marijuana, not good. It's estrogenic. It's hypoxicant. Also decreases tissue oxygenation. Can damage your lungs, cause emphysema. Chronic periodontal disease. The chronic inflammation can lead to, you know, contributing along those lines, a leaky gut. You can get bacteria also from your mouth, get into your blood. They're endotoxins, not good. Underwire bras, some increase in risk. So anyways, avoiding all these things. Now you know what to do. You just avoid all these things. And you will dramatically lower your risk of breast cancer. There's very low incidence of breast cancer in these old-fashioned countries where they eat plant-based diets. You know, so why not win the game that way? People think they're going to win the game getting a mammogram and, you know, chemotherapy and breast surgery. It's a much better to win the game this way. It's 1,000 times better to win the game this way. Anyways, hope you found that helpful.